pay through the nose with whatever we can get for our child. Another person says, I'm very frustrated that my son was removed from his IBI program due to his age, and he was doing awesome in it. Not only to be allowed back 3 years later, but what a waste of 3 years. I could not provide IBI therapy for him during this time for financial reasons. She goes on to say, my son is currently receiving a particular type of funding, but she finds that the funding that's direct service option is provided by a direct service agency who then subcontracts again. And so even the system that is in existence does not give parents an opportunity to make sure that they're getting the best quality services for their children. She says, I finally got him back, and now right away I feel there are plans to remove him. So she's finally got the services she wants, but there's a new fear on the horizon with a benchmarking system that's being put in place, and parents are fearful that, in fact, benchmarking is going to lead to kids being cut off. Another person says, in just total frustration, this problem needs to be addressed now! Exclamation, exclamation, exclamation. These kids are our future and deserve the right to be heard. Another one, the entire diagnosis process is very long. 9 or 12 months is a long time in the life of a 3-year-old. If all children could be diagnosed quicker, and if any pediatrician or specialist could make the diagnosis instead of a psychologist contracted out by the group that runs IBI. Again, a little bit, detail, but nonetheless, I think it's important to reflect on how many parents have the same experience of frustration and anger around this issue. Parents of autistic children already have the added stress involved in their caregiving. To have to go into grave debt to provide an education for their children is a total disgrace on the part of this government. I mean, I could go on and on. I was going to highlight 1 or 2 of these as I went through it, but in fact, I ended up practically highlighting the entire document. I'll end with this one. There is all this talk that early intervention is the key, but yet our government makes these children wait years before they offer financial support. We had to do whatever it took financially to get him help. It has financially ruined us, but how could I live with myself if we didn't get our child help? Autism has affected our whole family, emotionally, physically, and financially. So these are some of the voices of parents of children who have autism, and I'm now going to turn everything over to Bruce McIntosh, who is going to talk to you about some of the work he's been doing to uncover some of the numbers, I think, that we need to be aware of about what's happening here in Ontario. Bruce?
Good morning. As Andrea told you, my name is Bruce McIntosh, and I represent the Ontario Autism Coalition. We, as an organization, represent over 1,000 families across Ontario who have been touched by autism. And I got to tell you, I'm pretty tired this morning. I am tired of this fight. I am tired of fighting for what our kids need and what they've been promised and what they deserve. I am really tired of the nonsense that is coming out of the mouth of our Premier and his cabinet ministers when they talk about what's going on with respect to the autism file. On March 21st, Dalton McGuinty was quoted in the Dundas Star saying, Minister Matthews was quoted in the Dundas Star saying, quote, any disagreement between parents of autistic children and the provincial government has been settled. Well, I'm here this morning. A wire story here that this is out of CP from April 29th of this year. This is a good one. The wait list is getting longer because the province is putting more money into providing therapy for autistic children, said Premier Dalton McGuinty. Because we're spending more money, the wait list is getting longer. This is Orwellian. This is doublethink. I do not understand how this man can say these things. And then our Minister of Education, Education Minister Kathleen Wynne, this is Canadian Press as well, says the province is working towards providing a range of services for autistic children in school, including IBI, which is key to helping kids get off the wait list. she makes a point of saying IBI in schools. In fact, the Liberal platform document in the last election, page 7, committed $10 million to delivering quote-unquote IBI on site. And yet, last year, the then Deputy Minister of Education sent a memo to all school boards and ministry representatives saying specifically not intensive behavioral intervention IBI that is used by the Ministry of Children and Youth Services. These are just utterly inconsistent statements with reality and with one another. And that seems to be the tail of the tape. If this government is and has been in total disarray dealing with the issue of autism, I don't think that they themselves, by their words, know what they're doing. What I can tell you is what their numbers say for them. That's the wait list since 2003 to 2008. Now, I am not sure exactly how one is to judge success, but I would think that one component of success would be that at some point that line ought to go down. I would ask you to please note that it never has ever gone down. And I'm giving the government a good deal of credit by showing this graph, because this, you see, is the wait list for children who have been deemed eligible for the program and are simply waiting for service to start. There is another wait list, numbers that the government does not refer to, they will only quote you this number, of children who are waiting for that assessment. And that, over the last 3 years, has been pretty consistently close to 400 kids. So at no time, unlike what the previous minister, Minister Chambers, during the last government mandate, said that they'd finally turned the corner and had more kids in the program than were on the wait list, they never did. It's just that there's one wait list that you wait on to be told whether you have to wait longer or not. And if you don't have to wait longer for this program, then you're going to wait a hang of a lot longer for absolutely nothing. Now that would be the way that I would judge success. Here's how I judge abject failure. We took a survey of families with autism, and not merely the members of our organization. We posted it on the internet, and the only requirement was that you have a child with autism. And we asked a number of questions, and I'd like to tell you a little bit about what waitlist parents have to do. 47% of them have had to liquidate assets. 62% of them have had to borrow money. 11% of them have received money from registered charities. 4.2% of them have declared bankruptcy. And I'd like to give you a little bit of context for that number. In the general population across Ontario last year, 0.2% of Ontarians declared bankruptcy. A little over 31,000 of them. And so this premier and these ministers who have declared a war on poverty are driving the families of children with autism into bankruptcy at 21 times the rate of the general population. And that, my friend, is failure. These are the people who have actually had to cross that threshold